This minister in Glasgow has at least one funeral every week for people killed by drugs. The deaths here are counted in crosses, row after row. This is Scotland's drug death shame laid out.
The first drug death I dealt with was a 2-year-old girl, and that sticks with me quite a lot, seeing that pink coffin being brought in from a wee girl that picked up Valium that her mum had bought in the street and took it and died. When I see these families and look at death certificates now, increasingly I'm seeing cause of death unascertained or cause of death natural causes when the family are telling a different story.
Callum was a 23-year-old with no health problems who died suddenly just before Christmas.
This is death certificate. We still don't know how he passed away.
It says here, cause of death unascertained pending laboratory studies.
Yeah.
His family knows he used drugs, but Callum's toxicology report has been delayed up to a year. For now, officially, he's not counted in Scotland's drug deaths.
Waiting to find out, what was in his system, if it was something, and in the meantime, other people could be taking that stuff and the same could happen to them.
They could be taking the same drugs?
Yeah.
That Callum is using?
Yeah, it's prolonging a police investigation, so the police can't do anything until toxicology get back.
Scotland had just over 1,000 drug deaths in 2018, the worst in Europe. But almost 2,000 toxicology reports had been delayed at the end of last year.
People are dying every single day, at least 3 people a day, possibly more. And the fact that we don't know and that our government and our public bodies are not making it a priority to find out is shocking. In my view, we need an inquiry to get to the bottom of this, to make sure that lessons are learned, but really to hold people to account.
The latest drug death stats for Scotland are due out in July, but there are doubts the Scottish Government can possibly know the true number of people dying and what drugs are killing them.
It will be for the National Records of Scotland and the statisticians to be confident that they have the data as it should be, but
that's not an assurance you can give to
I think the assurance that I can give is that having spoken to the Lord Advocate, I know that he understands the importance of reducing that backlog so that families can get that information as soon as possible.
Do we really know the full scale of this drug death crisis?
I think it's really important that we look at the statistics when they are published.
Tomorrow, Glasgow hosts the first of 2 summits trying to solve the drug death crisis. Finding answers is difficult. It's harder still when no one can say for sure just how bad Scotland's drug problem now is. Peter Smith, News at 10, Glasgow.